The lead study, which we conducted at the Centre for Eye Research Australia, was really looking at that, intervening early in the disease to try and stop progression to either form of late AMD. The lead study was using a novel laser to try and reverse the aging changes that occur in the retina, to slow that process down or indeed to stop it. So the general advice still is for people with a family history of AMD is to perhaps when they turn 50 and are looking to get reading glasses, that they should go to their optometrist or ophthalmologist if they have one, just for a routine review of their ocular health, which would include a look at their retina. If they have the early signs of AMD, they would be given a chart called an Amsler grid, which is basically a piece of paper with a grid on it, and they're asked to monitor one eye at a time, looking for any significant change in vision, usually a blur or distortion. But the idea of that is really to cover one eye and just check that you can see all right with the other. So in the study we were quite particular that we wanted people with large drusen, so by large I mean greater than 125 microns, and we also wanted people who hadn't already progressed to the very early sign of cell death. So for our study, they actually were here for several hours because we did a lot of imaging, because we wanted to very well characterise what they looked like. And then we also asked them to do tests that let us know how their retina was working. And the idea was that after the laser we could then monitor that as well. And after the laser they were then seen every 6 months, had all their imaging and all that functional testing done again. In the 1990s we used a thermal laser to try and get rid of the drusen, and we thought by doing so it might slow the risk of progression. Whilst the laser did seem to reduce drusen, it didn't really slow the progression. And so after that, Alex designed this laser that hopefully brought about the good effects of photocoagulation, which is to hopefully rejuvenate a layer of cells that's not working, but not the bad effects of the actual thermal killing of retinal tissue that you want to save. So this 2RT laser is still very novel, and we're still working with our basic colleagues, Professor Erica Fletcher at the University of Melbourne and her team, to try and understand actually how it works. So the initial theory was that applying the laser to this supporting layer of cells called the retinal pigment epithelium may very well cause that layer of cells to divide and give you daughter cells that are perhaps sort of acting like younger cells.